Imagine this. You wake up with sharp chest pain. You panic, call an ambulance, and the paramedics, thankfully, save your life. But a few weeks later, you open your mail and boom, you see this $1,300. That massive number is just for a simple 15-minute ride across town. And in some states, that single bill can easily spike above $3,000. No way, right? And the absolute worst part? This is usually just the opening act. It's literally only the start of the bills.
Zooming out to the macro level, the sheer spread of this money problem is just staggering. Over a third of all U.S. households, 36% of us, are currently burdened by medical debt. You know, in most developed countries around the world, interacting with the healthcare system is primarily about, well, getting better. But in the United States, it almost inevitably becomes this massive financial hurdle.
Just look at the sheer scale of the borrowing. $74 billion. That is the jaw-dropping amount of money Americans borrowed last year alone just to stay healthy. I mean, people aren't taking out these loans to buy houses or start a new business. They're taking on this mountain of debt simply to afford basic medical survival.
Which brings us to the core mystery of our investigation today. If we spend the absolute most on healthcare globally, why does the system feel so fundamentally broken to the people actually using it? Let's dive into the data to find out exactly what is going on behind the scenes.
In 2024, the U.S. spent nearly $15,000 per person on healthcare. That is essentially double what countries with similar top-tier economies, places like Germany, Canada, or the UK, spend on their citizens, which hovers right around $7,500. It brilliantly illustrates the gap we're dealing with here.
Now, a lot of people immediately assume that this premium price tag must buy premium care, right? Better doctors, more advanced machines. But the data shows that quality is not the reason for the high price. It's a false cause. Those other nations also boast top-quality medical systems, incredible doctors, and highly advanced life-saving machines. So if we aren't paying double for significantly better outcomes, what are the real culprits driving up these costs? The first real culprit is how the market is structurally built. In comparable countries, healthcare is a relatively straightforward public service funded primarily through taxes. But the U.S. system? It's a highly complex market filled with an enormous insurance middle layer. This generates what economists call extra system costs, roughly 25%. Yeah, a full quarter of all U.S. healthcare spending goes entirely toward billing, marketing, and paperwork. That is billions upon billions of dollars that never even touches actual patient care.
Let's see how this builds into the everyday patient experience. You don't just pay a simple fee for a service, you navigate a total financial maze. You have your monthly premiums, which is really just the cover charge to get your foot in the door. Then come the deductibles you have to meet before insurance actually kicks in, the copays at the doctor's office, the co-insurance percentages. It's this confusing, layered cake of fees that leaves patients totally in the dark about their actual financial responsibility until that final bill drops in the mail. Now, what's really interesting here is the absolute absurdity of how things are priced. There is zero centralized pricing control in the U.S. system. You could get an MRI scan at Hospital A for $400 and then travel just 10 miles down the road to Hospital B and be charged $4,000 for the exact same scan using the exact same machine. Treatment costs depend almost entirely on secret, backroom deals made between hospitals and insurance companies, rather than the actual medical care you receive.
Our third culprit driving up costs? Pharmaceutical markups. While other developed nations sit down and negotiate or fix drug prices at a national level, the U.S. essentially allows pharmaceutical companies to charge whatever the market is willing to pay. As a result, the exact same drug is, on average, 2.8 times cheaper in 33 other countries than it is right here in the U.S.
And for brand-name drugs manufactured by pharmaceutical giants like Pfizer and Johnson & Johnson, the disparity is even more drastic. Those highly sought-after medications can be up to 4 times the price in the U.S. compared to almost anywhere else in the developed world. It is a staggering premium placed on the exact same chemical compounds.
We really have to bring this back down to reality and look at what happens beyond the abstract economic data. So the crucial point is how this simple math plays out in real life. Let's walk through this together. Say you need a $10,000 procedure. Your insurance steps in and negotiates that down to $6,000. Great, right? Well, actually, wait. You have a high deductible plan. That means you are still on the hook to pay the first $3,000 entirely out of pocket. For millions of Americans, having insurance doesn't actually protect them from having their life savings wiped out by a single hospital visit. And the fear of that simple math has severe health consequences. A full 33%, literally 1 in 3 Americans, report that they actively skip or delay necessary medical care because of the cost. When people are terrified of the impending bill, they ignore small symptoms. Those ignored symptoms then turn into serious long-term diseases, which ultimately makes the entire country less healthy and the healthcare system exponentially more expensive to run in the long term.
So, who benefits from this system? Because make no mistake, while everyday patients are struggling with crippling debt and delaying care, the system is not actually broken. From a purely economic standpoint, it is working exactly as it was designed and built to work.
The massive profits are flowing directly to the middle players. Insurance companies, big drug companies, and large hospital systems are seeing huge, consistent revenue growth year after year. The system operates as a massive profit-driven industry, and the systemic beneficiaries are squarely the corporate entities facilitating the care, rather than the patients actually receiving it.
The ultimate takeaway is this. The problem isn't the dedicated doctors, the incredible nurses, or the advanced medical technology. Not at all. It is a structural system built on intentional complexity and completely uncontrolled pricing. Getting sick in America remains a massive, terrifying risk to both your physical health and your wallet.
In the American system, the cost of staying alive is often higher than it should be. If this system is functioning exactly as it was designed, to maximize profits, the real question we have to ask ourselves is, what will it actually take to redesign it?